I'm Dr. Chris Landon. I'm Director of Pediatrics at Ventura County Medical Center. In my role, we have a pediatric diagnostic center. We see many children with many diseases. This has led to really the intersection where we have to put research and tie it into patient care. We have the Landon Research Institute, which allows us through grant funding to pursue a number of projects to improve the lives of our children and adults too. We have a number of pediatric illnesses that now survive into adulthood thanks to some of the research even done here. One of the most difficult problems we have is that there's a delay in receiving laboratory results on sputum from babies and infants, children, adults, up to 5 days, sometimes 14 days before we can actually make a treatment decision. Last summer and the summer before with our student scholars, we look at using the xenos to look at volatile organic compounds in the breath of these patients. We were able immediately to identify the predominating bacteria in their lower respiratory tract, and although at that time we didn't use it to guide our treatment decisions, we really see this as the wave of the future. I think that the nice thing about the xenos, originally it started out we almost needed a PhD to run it. We're now down to a third-year medical student, can easily operate it and understand and interpret the device. We really look forward to working with the xenos in terms of bringing it down to even less education required to interpret the results. When the patients come in, we have to prepare them because if they've been chewing mint-flavored gum, it's going to show up on the xenos. We have results within 15 minutes though. What we do is we collect the air. We want to do it from the lower respiratory tract, and so we have certain protocols that we follow. We collect this in what's called a slick stick, heat that up, and have results that are interpretable literally within minutes. What we've been looking at primarily is Pseudomonas aeruginosa. In babies, the sooner we treat it, we can wipe out the carriage and really put several years on their lives. The earlier we catch Pseudomonas. We've been able to expand this, however, down to Escherichia coli, E. coli in the lungs, which is normally a bacteria found in the intestine, Staphylococcus aureus, and we're looking at other bacteria as well. We were invited by the Gates Foundation sponsored Foundation for Innovative New Diagnostics based on the work we've done with bacteria. We made a presentation in Geneva, Switzerland, and brought back a project which we performed in collaboration with our public health department. We were able to identify from culture weeks earlier than would normally be accomplishable from bacterial, mycobacterial culture utilizing the xenos. We were able to identify Mycobacteria canzaceae, Mycobacterium avium found in HIV, patients with AIDS, as well as Mycobacterium tuberculosis. Each of them had a unique volatile organic compound signature which allowed us to differentiate the bacteria. For our patients, what we're working on now is really simplifying the collection. My patients are used to doing pulmonary function testing and are told to blow, blow, blow. So they're pretty easily able to empty out their lungs. We're looking at different methods now. For our babies, by using special masks and special valving, we're able to collect enough air to even look down to age 1. And we're looking even smaller, looking forward to funding to really help us to get down to that level. For me, because I'm all over the hospital, I'm in the emergency room, and we're trying to make a decision. Is this pneumonia due to a virus, in which case an antibiotic would not be helpful? To know that literally within 15 minutes or so will save us developing antibiotic-resistant bacteria by prescribing antibiotics when really it's a viral illness. Out in the field, looking at tuberculosis, the faster we know that we have effective treatment. So by being able to test a patient, get the results back from their culture faster with the xenos, and then be able to test the patient again to know when that mycobacteria is no longer putting out volatile organic compounds below and telling us that really they're no longer infectious to other people. We're also looking at ventilator-associated pneumonia. This is a problem because we have so many multiply resistant bacteria in our intensive care units. By being able to look at the lower respiratory tract in someone on a ventilator and know whether they have a significant bacterial pneumonia or not is also going to help us from breeding these multiply resistant bacteria. The other area we're looking at now is methicillin-resistant Staphylococcus aureus. There's legislation in California, but also throughout the United States. When patients come in the hospital, they return from having been in the hospital 30 days earlier, return from nursing homes, or they're at risk for spreading methicillin-resistant Staphylococcus aureus, we have to wait 24 or 48 hours while we culture their nose or their rectum to make certain that whatever problem they're having isn't due to this tremendous, powerful pathogen that's resistant to most of our antibiotics. So by using the Z-nose, and that's what we'll be looking at this summer with some of my scholars, we'll be hopefully able to identify in the emergency room within minutes whether a patient is carrying methicillin-resistant Staphylococcus aureus. The savings to the hospital is incredible because this will save them from being placed in rooms isolated from other patients, and also potentially save them from being placed on expensive and potentially dangerous antibiotics that would have to be directed against this methicillin-resistant organism. Probably the biggest thing is to have a partner with EST, to know that this research is appreciated, and to have a partner who's interested in the instrument side while we provide the clinical side. I think there are other applications which we haven't talked about, including early detection of lung cancer that you'll hear about as well over time.